Hello, Mr. Neville. My name's Dr. One of the doctors here, and I'd just like to examine you if that's okay.
Yes.
All right,
yes.
thank you. I'm just going to start by rolling your trousers up. Thank you. I'm just going to stand back and take a look at you. Okay, thank you. Thanks. Can you just hold your hands up for me? Can I just ask you to put your hands up for me? Just want to have a look at them. Thank you. All right, and if you can just turn your hands over for me. Okay, thank you. Just going to have a feel of your pulse if that's okay.
Yes.
And can I feel the other side? Thank you. Do you have any pain in your shoulder?
No.
Okay, I'm just going to lift your arm up. Thank you. All right, I'll then go on to check the blood pressure at this point. Okay, I'm just going to have a look at your neck and your face, please. So just turn your head slightly that way for me. Lovely. That's fine. I'm just going to press on your belly. Just relax that hand down for me a second. That's fine. Once more. Okay, I just want to have a look at your face if that's okay. So just look towards me. Thank you. Okay, just open your mouth for me. Pop your tongue to the roof of your mouth and out. Thank you. All done. Can I feel the pulse in your neck? And I'm just going to feel the subclavian pulse. Thank you. Just going to feel your chest if that's okay and examine the front of your chest.
Yes, doctor.
Okay. Okay. Okay, thank you. I'm just going to have a listen with my stethoscope. Just have a feel for the pulse here. Okay, what I'd like you to do is just put your left arm behind your head and just roll over slightly onto your left side. Thank you. Are you comfortable? You can roll over a little bit further. That's easy. That's perfect. Thank you. Okay, thank you. All right, and just pop your arm down. Sit forward for me all the way. Lovely. You okay?
Just straight up?
Yeah, that's fine. You can just lean slightly forward. Okay, breathe in, breathe out, and hold it there. Breathe normally for me. Breathe in, breathe out, and hold it there. That's fine. Thank you. Okay, relax. In fact, I'll just have a look at the back of your chest. I'll just have a quick listen. Breathe in and out for me. That's fine. Relax back for me. Okay, that's fine.
Thank you.
Oh, thank you. Just going to examine your legs, if that's okay.
Yes.
Okay, thank you. Pull that down. I've now completed the cardiac examination. I've assessed the patient's blood pressure, assessed for any radiofemoral delay, and examined the peripheral pulses in their entirety. I'd also checked the patient's TPR charts, assessed their temperature, pulse and respiration, and dipped the urine for blood or protein. Mr. Neville appears comfortable, he's breathing at a good rate and a good colour. When examined, clinically his pulse rate is slow and irregularly irregular. Auscultating the precordium, it's clear that he has a soft systolic murmur in the aortic area together with a metallic S2, which can actually be heard without the assistance of a stethoscope. There's a median sternotomy scar, an absence of vein grafting scars from the lower limbs, and mild peripheral edema. I also found a few small splinter hemorrhages when examining the patient's hands. These were isolated and not associated with any Janeway lesions or Osler's nodes. Importantly, the patient didn't have any clubbing. In summary, Mr. Neville appeared to be comfortable, breathing at a good rate and a good colour. Clinically, he had a slow, irregularly irregular pulse, which would be in keeping with slow atrial fibrillation. Without auscultating the chest, it was clear to hear that he had a metallic heart sound. However, on auscultation, it was noted that he had a soft flow murmur in the aortic area, together with a metallic S2. In summary, Mr. Neville had slow atrial fibrillation and a competent metallic aortic valve replacement. There was evidence of isolated splinter hemorrhages, but no other stigmata of infective endocarditis. It was clear to see that Mr. Neville had a single median sternotomy scar that wasn't associated with vein harvesting scars from the lower legs. This would suggest that he's had a valve replacement in the past. This was confirmed by auscultation. We noted that Mr. Neville had isolated splinter hemorrhages. These don't necessarily mean that he's got infective endocarditis, as trauma can also cause these. So it's important to mention to the examiners what you've found and the absence of any associated other stigmata of endocarditis.